Forgive me, Father, for I have sinned. It's been a really long time.
Please begin.
Well, at work, I'm an HR director.
All things can be forgiven, my child.
Oh no, that's not my confession.
Oh, sorry about that.
Anyway, I just attended a CE class about the new fiduciary rules that apply to me for our group health plan. I've always specialized in group benefits. 7 of the 11 acronyms I put behind my name in my LinkedIn profile are specific to benefits. I've always prided myself on how well I could put together a benefits package that would impress recruits, retain talent, and take care of our people.
That all sounds fine. Although pride is probably never a good word.
Oh, I'm not proud. At least, not anymore.
What changed?
All at once, my eyes were opened. I saw our benefits were, well, not beneficial.
Yeah, okay. Now you lost me.
Well, my work bestie, Mandy, told me during open enrollment that she was opting out of our medical coverage this year. I couldn't believe what I was hearing. Her husband is self-employed. He doesn't have medical benefits. What was she gonna do? Go without insurance? She has a thyroid issue.
Odd.
Right? Well, she said she wasn't planning on getting insurance. She was participating in a health cost sharing program. I got the ick so bad just hearing it. Those aren't government backed. Who's to say they'll even pay their claims?
Actually, we've used a faith-based sharing ministry called Metashare here for years. We love it.
Right, but I read that, unlike insurance, they can deny claims for pre-existing conditions. And I thought, bingo, Mandy's thyroid issue would never be covered. Of course, I called Mandy immediately to gloat that I was right, and I couldn't believe what she said.
What?
She already knew about that. She called around and found out she could get her treatments for $4,000 a year if she paid cash. She said that's less than half of what she's saving in insurance premiums.
Wow. Wait, but isn't your employer paying part of the insurance premiums?
Well, yes, that's what started this whole thing. We opted to use Common Care to administer our plan this year, and our employee association voted to put the employer contribution in the cafeteria plan, so people can choose to use it on any benefit, not just toward major medical premiums. They can put it towards dependent care, their HSA, or Mandy is choosing to take it home as taxable wages, like a bonus.
Holy Virgin Mary, that sounds pretty good.
I was panicking at first. We can't just let people choose cash pay right alongside their medical insurance. I thought. But then I couldn't think why not. It dawned on me so suddenly I fell to the ground. When I got up, I couldn't see. I didn't eat or drink for 3 days.
Incredible.
I saw the light. I realized our benefits, they weren't benefits. Our claims show $27,000 per year for Mandy's thyroid treatment. Oh, is this booth HIPAA compliant?
Yes, of course.
Okay, good. Anyway, $27,000 versus the $4,000 she negotiated. All those networks and drug plans, they were legally binding us to pay ridiculous prices. Our TPA still doesn't understand what that means. They're incredulous.
Wow. That's a lot to take in. I'm still not sure I see the sin in all of this.
This is all the exact opposite of what I've been telling companies to do all these years. The exact opposite. The ACA is so overwhelming, I never wanted to make a mistake. I thought if we offered coverage with the most comprehensive networks and drug plans and push for the highest participation possible, I maintained the strictest zeal that we were doing everything in our power to take care of our people.
But I obtained mercy because I did it ignorantly in unbelief.
Well, it turns out all we were ever doing is cramming everyone into really inefficient plans. Even when we self-funded, the pricing and administration was controlled by insurance networks. I thought this was all necessary. I thought the law required it. But it turns out employer plans are subject to quite different laws than insurance companies.
But now we are delivered from the law, that being dead wherein we're held, that we should serve in newness of spirit.
We did it all wrong. Most people weren't benefiting from our benefits. And we were taking their dollars to cram them in there. Millions of dollars died, and I stood there giving my approval.
What do you mean taking their dollars? Weren't they employer dollars?
That's just it. There's a budget available for each position, which can be split between benefits and take-home pay. And when we offer benefits, it lowers the amount of take-home pay we can offer. Structuring compensation packages is something I took so much pride in. I thought I knew what was best for everyone. I thought they should be grateful to have someone so capable making their decision for them. But even my best friend really wanted transparency and options.
What about people who really need the insurance? I mean, I know your friend found an inexpensive solution, but all are not so lucky.
Of course, a lot of people still choose more traditional options, some for good reason, and some because they just haven't opened their eyes yet. Options and transparency turn out to serve everyone best.
And where the Spirit of the Lord is, there is liberty.
I can correct this. I've left my old ways behind. Our plan is saving over 50% on claims costs this year since we're able to contract directly with doctors.
If you have no network, how does someone know if a doctor will treat them?
Oh, we have a network, our very own network. Common Care gave us a lot at launch, and we add new doctors every month. Turns out if you can pay cash immediately with no complications, doctors love working with you. It's awesome. We have this asset as our health plan now.
Well, what about an emergency? There's no time for negotiations there.
Right? That's one of the most diabolical parts about networks. When an employee goes to the ER, the network lays out services like coins in Super Mario. There are pages and pages of pre-negotiated services that you're contractually obligated to pay for. Hospitals ping as many of those as they can, and that's how you get such big hospital bills.
Well, how do you fix that?
Well, first of all, hospitals live in a sea of denials from treating uninsured to insurance companies to Medicare and Medicaid. If you can offer to pay cash immediately, they'll often reduce your bill big time. And second, we have a billing mediation service at Common Care that will review the long list of line items and can get a lot of them dropped. And third, there's a federal law that providers can't balance bill patients for emergency services when they're out of network.
Meaning?
Well, it means that they're in a bit of a gridlock with us. Hospitals can't just bill for every conceivable procedure and pass the bill to the patient if the plan won't pay. So now they're motivated to settle, especially when we can pay them quickly. Time and receivables matters a lot to these facilities, and disputes are expensive and often don't pay.
So, even in an emergency, the network was no help.
Exactly. All the times I told people how badly they needed that stupid little worthless insurance card, like a little pass that says, someone else is paying, don't worry about the cost. Meanwhile, that someone else who was paying was really you all along, when premiums go up every single year.
Judas Priest!
Yep. My allegiance was to the wrong team. I've always been so worried about how expensive it would be to cover medical costs without insurance. I couldn't see we were paying them the whole time, only at rates dictated by insurance networks. Increasing premiums means increasing profits for our carriers and of course, our broker. Of course, all these years I've been telling everyone what a benefit it was that we solved all this for them. I could never see that shuffling costs around doesn't decrease them. We all bear the cost of healthcare in our lives, at our companies, and as communities and a nation. I don't know how that was so hard to see.
Well, this has certainly been eye-opening for me.
Do you think redemption is still possible for me?
At this point, I'm actually more worried about the rest of us.
Don't take this the wrong way, but you've probably set up your group health plan all wrong. The good news is, there's never been a better time to repent. Visit commoncare.org to give your health plan a new life.